Hello, my name is Brent Porter. I'm a specialist in internal medicine. I chose my particular specialty, internal medicine, because I wanted to keep things at a more general level and yet still be able to have regular contact with patients. I enjoy working with them on a more personal level. I find it interesting and I enjoy looking at a patient as a whole as opposed to just one aspect of their medical care. I would want a patient to know that at our practice, we try not to rush through the appointments. We know that it takes time to sort through their medical problems, that not everything is obvious or easily stated in just a few sentences. I think what's different about me in particular in my background is I did spend 20 years in the Air Force, and so I can relate to some people who have a shared experience. It's different than what some other doctors have done. Listening is important because it takes time. And the only way that medical care works or that medical care can be provided well is through listening. 90% of the diagnosis is obtained through what a patient says as opposed to any other tests or any other lab work that's done. It's got to be in what a patient has to say. So you've got to be open, you've got to make time, you've really got to listen and be certain that you fully understand what a patient is trying to tell you. What I find rewarding about my job is really two different things. First, it is interesting. Every day is a little bit different, at least. Secondly, although it's not always obvious, I think that what we do at the office really does help people. Outside of work, my family lives on a small ranch close to Rockney. We got our chickens, we got our cows, we got our trees, so we try to take care of it. Spend some time on the tractor.